In every country, there are different beliefs about women when they are pregnant. But it is very important to know things from the medical perspective. Dr. Shelly Batra tells us about such myths and beliefs and how true they are.
Now, there is one myth that one has to eat for two during pregnancy. That is not correct at all. I've seen mother-in-laws stuffing their daughters-in-law with food and forcing them to eat food to the extent that nausea sets in and they start throwing up. And this is not to be recommended at all. So what one has to do in pregnancy is to eat a healthy diet. The amount of food has to go up by maybe 25%, and the nutrition of the food should be much more than what it should be. One has to avoid junk food because junk food is empty calories. Now suppose a lady is pregnant and she were to have, fries and burgers and pizza and cola drinks. Her tummy will get full and she'll feel satisfied. So she cannot have a nutritious diet. So what is advisable is a good diet, plenty of calories and nutritious food. But you don't have to eat for food. The other myth is that you cannot have sexual relations during pregnancy. Now, relations are avoided. They are to be avoided if you have a risk factor that can provoke a miscarriage or a premature delivery, or if you're on absolute bed rest for any other reason. Otherwise, one can have normal relations till the last few months. There's one thing about exercise in pregnancy that I must mention. A lot of women say you should not exercise. Now, all the factors that I've mentioned where you should not work are true for exercise as well. If you're healthy and fit and there are no adverse factors, you can do your normal exercise. What you cannot do is this. You cannot lift heavy weights. You cannot do competitive sports. You cannot try and get exercise gains. You cannot try and go the extra mile. You cannot try, if you were running 1 mile, you cannot start running 2 miles. What you have to do is to cut down on high impact exercises like running. So walking and swimming at a slow pace, these are very much to be recommended. Of course, each country has its own, doubts and, people have things in their mind. Have this color of food and the baby will be born fair if you have milk and milk products. There's nothing wrong in these myths because the more milk and milk products you have, the better it is. So maybe some myths are useful for us as well.
The breaking of these myths should now help you maintain health in your pregnancy. For more videos related to pregnancy and health, log on to onlymyhealth.com.